Did it tell you guys it was recording?
Yeah.
Perfect.
All right, well, I'm gonna go ahead and start the introduction. So good afternoon, everybody. Thank you for joining us for our 4 p.m. Central session, providing a lifetime to young adult survivors through a unique wellness intervention. And our presenter today is Dr. Zoanne Dreyer. She is a professor in pediatric cancer survivorship at Texas Children's Hospital and clinical director of the long-term survivor clinic at Texas Children's Cancer Center. Over 1,000 childhood cancer survivors are evaluated every 1 to 2 years for delayed effects on their prior cancer therapy. Survivors are patients who are more than 5 years from their diagnosis and off therapy of at least 2 years. There is no upper age limit for survivors followed in the clinic. Survivors are now invited to become participants in a novel program, the Passports for Care. Dr. Dreyer earned her bachelor's degree and medical degree from the University of California in Davis, California. She served her internship, residency, and postdoctoral fellowship at Baylor College of Medicine, one of the nation's leading medical schools. Thank you so very much, Dr. Dreyer, for being part of our convention this week. Being this is a CE session, we have provided the link for you to receive the hours for that in the chat. And also, if you have any questions, please post them in the chat and we will present them to Dr. Dreyer following her presentation.
Okay, I'll stop sharing and then we'll let you go ahead and share out, and I will spotlight you at the top while you're talking to.
Shall we go?
Yeah.
Okay, great.
Go ahead and share your screen out for us.
Okay, so you should be seeing it, right?
No, I was sharing right before you, so if you can reshare again.
Me?
Yeah.
You.
Go back to your share screen button.
I thought we just had this fixed.
We did, but I had to share the opening screen, so it kicked you out, I think.
So now, is it showing? Should be.
Nope, I don't. There we go. It's coming across. There we go. I can see it. Yeah, we are good.
Okay, here we go. All right. So it's a real honor to be here today to talk to you about a part of camp life and survivorship for a group of patients that are typically overlooked. And we titled this Providing a Lifeline, which I truly believe is the case for young adult survivors through some unique wellness programs and interventions that were developed at the Periwinkle Foundation. And now we hope the forward button is working, which it's not. Okay, there we go. As most people know, cancer survivorship has improved dramatically over the last many decades. And while in the 60s and the 70s, cure rates were really barely 50%, now in 2018 and above, we actually say that over 80% of childhood cancer patients will be cured and be long-term survivors. When you look by decades, and you can see in this diagram, the gold are the newer decades, the 2000s, the blue are the older decades in the 70s, where in almost every disease, really in every disease category, we've made tremendous strides, which results in a much bigger survivor population. For us here, our definition of a long-term survivor is someone who's about 3 to 5 years from their primary diagnosis. Generally, we say about 2 years off of therapy. And for our survivor program here, we actually have no upper age restriction. And that's one of the things that makes this opportunity unique and our program unique. The majority of survivor programs really cut off survivorship at about 18 or 21. And it's really in those young 20s when we start to see, especially the psychosocial issues, that is really the focus of this presentation. There are many challenges that face survivors. The challenges can be based on their treatment, their chemotherapy. Of course, radiation is a big toxin, and surgery. We'll talk a little bit about what some of those side effects are. It can also be based on the primary disease and the risk of recurrence of that disease. And also, as you know, some of our cancers, like Hodgkin's, for example, are highly associated with the development of secondary cancers. The duration of time from the original diagnosis also increases the risk for most of these side effects. So these are things that truly are always on our minds, but also on the minds of our survivors as they get older and older. Just as a little summary of what we might think about as late effects, we kind of think of it as an organ system way. We think first of the central nervous system, because that's one of the first things parents ask us about when a child is diagnosed. What will they be like? Will they be able to function? Well, we know, for example, for our brain tumor patients that get the high doses of radiation, and even for some of our leukemia patients that get radiation if they have leukemia in their central nervous system, they can have some pretty significant impact on their learning, attention, focus. So those are areas of great concern to the parents. Those are also areas that go into sort of the developmental progression of some of these survivors who have these very high doses of radiation, particularly to the brain. We also know the hormonal system can be affected. That's usually through radiation as well. Radiation primarily to the head and neck. After parents want to know if their child will be able to function, they want to know if they'll look like everybody else. Well, a large number of children, again, brain tumor survivors primarily, will have growth hormone deficiency as one of the most common deficiencies secondary to radiation. So while the 18-year-old may be cured of his brain tumor he had when he was 3, and he's 4'7", he is not a happy survivor. So those are things that patients and survivors have to adjust to. Thankfully, now we have growth hormone therapy, which can really help them to achieve a more normal height. They just want to look like everybody else. They just don't want to stand out. The thyroid is highly affected, and a lot of kids go on thyroid supplementation, which is, of course, fairly minor. Fertility is an area of concern that we are doing a lot more work with now. It used to be pretty much limited to sperm banking, but now there are a lot of new oncofertility techniques to help maintain or hope to maintain fertility options, even for very young girls being diagnosed. I will say that in today's era, the majority of leukemia patients, really the majority of patients, will go on and be able to have children of their own. There was a lot of concern early on as to whether those children would get cancer. We haven't really proven that except for family cancer syndromes, but fertility is a big, big question for families. One of the first areas of survivorship that people realized was a big problem was in the heart. And what they noticed is long-term survivors of bone tumors called osteosarcoma, who get very high doses of a drug called the anthracyclines, which subsequently realized increases a risk for heart failure, would become pregnant, and they would have heart failure during pregnancy. So that was probably one of the first late effects that patients paid attention to. We now are meticulous about following the heart, but still, some patients, a small number, will go on and need a heart transplant due to heart failure from the drugs. We have some that can go on due to radiation complications that will develop collections of fluid around their heart that can be very dangerous, or even some really significant arrhythmias to their heart. We also know that radiation in the heart area can affect the vasculature of the heart, so that some young survivors, even 25 or 30, that had radiation to their chest, including their heart, when their young breast tissue was developing and their hearts were there, they can actually present with coronary artery disease and have a myocardial infarction like a 70-year-old man. The lung can be affected by radiation in particular, and some drugs, and develop scarring. But I think one of the things that plagues our kids the most, because they certainly see other patients that have this happen, is the risk of developing a secondary cancer. And about 8% of survivors at about the 20-year mark, certainly the 30-year mark, will have developed some form of secondary cancer. So it's bad enough to have your first cancer, and then it just is so much worse to have a secondary cancer psychologically. Most of these, thankfully, are skin cancers that are fairly easily treated, but some are very serious and really become life-threatening for these patients. One of the most common and most scary secondary cancers are breast cancers that we see in survivors of Hodgkin's disease, both in males and females who were radiated at the time their breast tissue was developing. Their risk is very high of breast cancer. The median age of Hodgkin's survivors developing breast cancer is quite young, 31. And we now know from big data sets that the risk for developing breast cancer in a Hodgkin's survivor that had radiation is as high as if you had the BRCA gene mutation, which we're all familiar with. And that's about 80% by the time you're 70 years old. So those secondary cancers are a huge concern, which also weigh heavily on these kids. Some will develop types of leukemias, and there are other miscellaneous secondary cancers. So those are just some of the risks that the patients face. But I think one of the things that we tend to overlook the most are the psychological stressors that they face. You know, it's easy to screen for heart function. It's easy to screen for lung function. It's easy to screen for hormones. And really all of our survivors in their annual visit will meet with a psychologist or a social worker. And so for that one day of that year, they have the opportunity to meet with somebody and discuss some of their stresses. But when you look at the things that worry them, it's not just that day, it's all the year long. They have fears of recurrence or secondary cancers. They oftentimes have very stressful anniversary reactions, meaning the date of their diagnosis, the date they finish therapy, quite often the date one of their friends died. They feel grief and loss because their best friend, Susan, who had the same tumor, died of it, but yet they lived. Several of them, many of them, in fact, suffer from some anger and depression, anxiety, and post-traumatic stress, especially those that don't look quite like everybody else or have really serious neurologic complications that don't allow them to function like everybody else. There's a fair component of survivor guilt. Again, she died, I lived. Why does that happen? And they do have problems forming relationships because you can imagine they've been sequestered within their family for such a long period of time. And when they go out into the real world, each and every one I've talked to, if their cancer history comes up in a discussion with a new friend that they've met, all of a sudden they have to go all through cancer again. And it generally starts with, oh my God, you had cancer and you're still alive. How could that even be possible? And they have to sort of relive all of that. So they face a lot of psychological stressors. And our idea was to see what we could do to help them adjust to those psychological stressors. There was an article that came out in the New England Journal a few years ago, and they looked at 20,000 long-term survivors. And this was a questionnaire study. We were part of that. And what they found was 2/3 of those survivors had at least one medical condition, of which 25% were serious. So that, you know, this is no small problem. And we really see the same thing in our population here. It's predicted that in the year 2022, 1 in 750 young adults will be childhood cancer survivors. So we will all know childhood cancer survivors. Well, obviously we will, but people out working at McDonald's or working in the schools are going to know childhood cancer survivors. And that's a big part of our population that we have to keep safe. We have to keep them healthy, and we have to help them to be psychologically sound. Because if you've cured the cancer, but your survivor is not psychologically sound, you really haven't done that much for them. So that's been our emphasis. This is a cartoon I found ages ago, which I thought was pretty hysterical. And it shows an old man who's sitting there going, hello, 911. I just thought I'd call and tell you how I am. Well, I can tell you in the early 80s, when kids finished therapy, they came back for maybe a year or two as we watched them for any recurrence of their disease. And then it was pretty much, bye, have a great life, stop in, and maybe we'll see you again. There was nothing about survivorship. Survivorship really became a focus of care in the probably mid 80s. We opened our clinic in 1988, which was one of the early clinics to open. But now when we write treatment protocols, not only is the focus on cure rates, but it's also on survivorship. So that's part of every protocol now as we try to improve our therapies, maintain good cure rates, but reduce the risks of late effects. We have a big team of people here. We have several campuses involved. I'm the medical director. We have research coordinators. We're involved in a lot of research. We have the clinical providers who go over all the risks and benefits and plan the surveillance studies. We have our social workers. We have financial counselors. So that's kind of the team that helps with our patients. And as I mentioned, we have no upper age limit. So we see 45 and 50-year-olds. I think we actually have one now that's in his young 60s. So where did this whole thing come from? We know that adult survivors of childhood cancer have difficulty adjusting to life, just like we've talked about. We recognize that the social and emotional and psychological needs of the long-term survivors are great. And based on that, the Periwinkle Foundation came up with the idea to develop a program intervention that would support the survivors' wellness and enable them through positive peer interactions through monthly socials. And as I mentioned, Periwinkle has provided funding for us since 1984, although this program is quite new. Periwinkle is a number of different things. You may have heard about much of them already in the conference so far, but camps, arts, and survivors are the main foci of Periwinkle. The mission statement is to provide programs that positively change the lives of children and young adults and families who are challenged by cancer and other life-threatening illnesses and cared for at Texas Children's Hospital. The Periwinkle name came from the vinca minor, the plant that was used to make vincristine. And it was actually named by the mother of one of our patients in 1983 as we planned for our very first camp. So that's how we became the Periwinkle Foundation. We have several different camps. We have our week-long Camp Periwinkle, which is ages 7 to 15. Of course, we haven't had it for the last 2 years, but hopefully this coming summer. We have a Periwinkle Day Camp, which is a Monday through Friday, where younger kids can come and learn about the camp experience and maybe get ready to do sleepover camp. We have Camp YOLO, which is designed for teenagers. They don't have to be survivors. They can be on therapy. It includes our cancer patients, renal patients, HIV, a number of different groups, so that the teenagers can be together for a weekend, Friday through Sunday, and realize that there are other people going through the same thing. And then we have Periwinkle Family Camp, where we bring several families, the entire family, to spend a weekend together. Now, COVID has obviously put a hold on all of these things for the most part, but we're starting to open up a little bit. Our arts program is extensive, also supported by Periwinkle, also available to our long-term and our adult survivors. We have an arts and medicine program where there are artists to work with the kids every day in clinic. We have an annual art festival called Making a Mark, and this art is, there are usually hundreds of pieces, and a select, probably 20 or 30 are chosen to travel around the country. Quite frequently, they're in airports, and they make a big, beautiful setup, and then they have postcards next to the art. So if you see a picture that you like that, you know, Johnny Sue did, and you want to write Johnny Sue a note, you can write a personal note to that artist, which goes to Periwinkle and then is sent out to the children. So they get such a thrill out of that. We have been able, despite COVID, to continue to have some of these displays up. The Splendid Review is what this boy in the picture is holding. It's a compilation of writings of the children, poems, stories, prose, all kinds of things that comes out several times during the year. And then during COVID, Periwinkle, always thinking ahead, came up with the idea of Creativity Connected. And what that did is it allowed our patients, young and old, in and outpatient, to connect to those artists, which they used to work with in real life, but now worked with virtually through our Houston Symphony, through Young Audiences of Houston, through Writers in the Schools, and a number of different programs, so that they could really still experience the arts, even though they couldn't do it in person. We have several events that we do to raise money, because as you know, we all are trying to raise money. We have a Kickball Classic, which is an annual event, Periwinkle Cycle, a cycling event, Iron Somm, which we just had last week, where the most famous somms around present their wines. We have wine tastings, and that's always really, really fun. And then, of course, like all of us, we have a gala. Ours is every other year. Last year's was virtual. And then the survivors, and we're going to talk about this in detail. There are monthly socials in our new program. There have been annual retreats for a long time. And we also allow our survivors to participate in a number of different volunteer opportunities within the Periwinkle program. So the program, the first intervention that we're going to talk about, began in 2018. And it was decided that our long-term survivors greater than the age of 18 with no upper age limit were invited to participate in monthly socials. Some of those patients even were still on therapy, but most were long-term survivors. They were invited to participate in monthly socials, the weekend retreat, and also to become volunteers. Of course, in early 2020, with the onset of the pandemic, the in-person socials were largely replaced with virtual meetings. We had 4 of those, and we had a few in-person events with appropriate precautions in place due to COVID. So the program The first program I'll talk about from 2018 had 46 survivors. They ranged in age from 19 to 43. The median age was 27. So these are not kids. The survivor diagnoses were, a variety, as you can see there. What's really important in this survivor population is 13 of those long-term survivors have significant ongoing physical and neurological sequelae, which will not allow them to ever live alone. So this program is a life-saving event for them because it allows them to be with peers who understand them even while they struggle with really significant complications. In that year, we had 366 combined years of survivorship. Prior to the pandemic, 420 encounters, program encounters, and over 1,200 hours of volunteer time from this survivor population. So prior to the pandemic, these monthly in-person activities included attending sporting events, arts events. We would sometimes go, I've gone a few times to the office and do an educational presentation on survivorship. They've had people come in and do career counseling to help the survivors learn to write resumes. Of course, there are always holiday parties and other theme-based parties. So just a variety of different things. Pre-pandemic, they were also invited to participate in a number of volunteer activities, including being counselors at camp, assisting in fundraising efforts. And there's nothing more powerful for a potential donor than to meet a long-term survivor of childhood cancer, since the majority of the world doesn't realize childhood cancer is even curable. So what we decided to do was to create a Survey Monkey questionnaire to determine the impact of this in-person program intervention on their overall wellness. And then what we did mid-pandemic is do the same survey based on virtual programming. So we could see if they were getting a benefit from the virtual programming as well as in person. So mid-pandemic, as I call it, had fewer attendees, usually 20 to 30. There were 2 in-person events. One was called Drive-In Movie Night, and they had a big screen outside and people drove in and watched a movie, and they went to an Astros game. Virtual programming included some lectures, one in particular on COVID. The survivors worked together to create a song, which is also part of the Periwinkle Foundation. It's called Purple Songs Can Fly. We have a studio in our clinic where singer-songwriters work one-on-one with patients to write songs, to express their feelings, and within about an hour, they walk out with a disc. Well, and I'll read you some of the lines from the song the kids wrote. They wrote this with their lead being a long-term survivor who had been a periwinkle camper, but is also an exceptional singer-songwriter. She was on American Idol. She writes beautifully. And so she helped them to create their song. They also had game nights and virtual escape room experiences, just a number of different things to keep them together, even if they weren't physically together. So one of the things we wanted to know is, what are the barriers you find yourselves living with? Barriers not only to come to events, but just general barriers. And these are some of the things that they identified. Some of them have a hard time doing things that require precision because of the peripheral neuropathy from some of our drugs, and that can be lasting. Some of them are very shy and never get out of their family because other people don't understand their background. Some of them struggle with chronic ongoing health issues, as we talked about earlier. Many of them suffer from self-esteem issues, insecurity, and depression. Some of our survivors are paralyzed because of the location of their tumor, which there's really nothing they can do with that other than to learn to live with it. There are long-term side effects, including mental health issues and survival guilt that we talked about. And during the period of COVID, a lot of them had fears of going out for fear they would get COVID or their children, if they had any, would get COVID. Other barriers that they identified that they live with day in and day out are concerns about fertility and mental health issues, the constant anxiety about getting a new diagnosis or recurrence of their original cancer, emotional issues like PTSD and living with survivor's guilt, new health issues, new things that have been diagnosed, like they were fine for 10 years and now they've got this, one of our patients has developed a significant peripheral neuropathy and vein disease. Many suffer from short-term memory loss. Of the patients that were surveyed, 20 responded, and 15 of them identified a barrier. A couple of them identified no barriers and a couple didn't respond. But as you can see, most feel that they face barriers every day. Here are just some pictures. This is drive-in movie. It was actually, as I recall, a gala auction item that someone bought so the kids could have that event. Houston Astros 9, socially distanced, please notice. And then Purple Songs Can Fly. This is the studio. And a woman named Anita Cruz in the middle put this idea together probably 20 years ago. We have this studio, which of course is closed at the moment, but here's one of my little patients writing a song. And 2 or 3 people work together with the idea that the kids come up with, the kids and young adults, and then they put together a song and they add the music, and it's very professional when it's done. In this picture, these are, one of them in the middle is the singer-songwriter, that's the leader, whose name is Christian, is in the middle with her Purple Songs shirt on. And those are other kids. And this was obviously before the pandemic because she's there in the studio. And here they traveled to Ronald McDonald House during COVID. So they could even work with a girl who was here from Uganda for some special surgery so she could have a song when she went home to Uganda. So they titled their song Technicolor Rainbow. And these are just some of the lines that I think are quite powerful. And so they now have this song on a CD. We're each other's mirror to help each other see. The future will live in full possibility. We see ourselves much clearer when we walk hand in hand, past the fear and struggles that only we can understand. Our scars do not define us. Bonded beyond chemo, we'll never give up. We see ourselves much stronger when we're moving in a pack. That's true. No matter the occasion, we have each other's backs. We're a family strong and proud. We shout it out loudly like a Technicolor rainbow. And I just think that that song and those lines, and there are many more lines that are powerful in it, but that's the story. That's what the survivors need as adults. This is a virtual escape room and also one of our lectures. Here's the escape room. You can see some people even have their kids involved. So how did we do this survey? So what we decided to do was to try to determine the impact of this sort of novel psychosocial wellness intervention program by doing a simple survey monkey. And the patient or the survivors rated the questions from 1, meaning not important at all, up to 5, life-changing. We also solicited free text. So 40 of 46 survivors completed the pre-pandemic survey, which is, if you've ever done surveys, that's an astounding number. Mid-pandemic, 20 of 30 survivors completed the survey. In the next slide, I'm going to show you the percent of patients that felt that the interventions were either life-changing or extremely valuable. And it's really interesting to see the comparison between the in-person socials and the virtual events. So pre-pandemic is red, post-pandemic or mid-pandemic is purple. Improved your sense of well-being, life-changing, 70 to 75%. Helped you adjust to your cancer history, 65%. Improved your self-confidence, 70 to 72%. These are all things that empower our survivors. And without this intervention, none of this would be happening. Helped you establish meaningful relationships with peers and family, life-changing in 70%. Helped you to manage, adjust, and accept ongoing late effects, which clearly from my population description earlier, there are a lot of ongoing life-changing effects, 65 to 68%. So there's some real power in these in-person or virtual events, which include survivors of all ages, of adult ages. Interestingly, the survivors reported that they enjoyed the virtual events through the long-term survivor program despite the pandemic. And frankly, based on the results, the pre-pandemic and the mid-pandemic impact was extremely close. So that even if they're not able to meet in person, to just be able to gather virtually together has an impact. We asked for free text comments, and these are some of them. Periwinkle makes me feel hopeful. This is my safe haven. This group helps me to come to terms with my long-term effects. My mental wellness is the most important part of long-term survivor care. And you know, we beat ourselves up in clinic, making sure we order the echo and the liver enzymes and the renal functions and all the rest of that stuff, which is important to their overall health. But they recognize their mental wellness as the most important part of their survivor care. I love this family. They will always be in my heart and a part of my life. This program is my family. These are my siblings. So those are pretty powerful statements. So that was the first intervention that I wanted to talk about. Then I wanted to talk about our annual long-term survivor retreat. This is, again, young adults and older adult survivors. It actually occurred in October with some in-person precautions. We've had it for many years, but this retreat takes place where we have camp at Camp for All, which is a barrier-free camp. This first event in COVID just happened. There were 8 survivors that attended, and 3 of them went for the first time. One was there for his 13th time. I'm pretty sure I know who that was. Activities include the usual camping activities, arts and crafts, fishing, horseback, ropes, canoeing, but they all talked about the group discussion time because that means so much to them because they feel safe and they can discuss anything. The precautions were that everybody had to be vaccinated. They had to have a negative COVID test. They had to always wear masks indoors. But frankly, most of the activities were outdoors. These are just some pictures of the survivors. There are a few new ones there. There's several that are always there. Some more pictures of them getting ready to do a water activity. This is a young man with a brain tumor who has some fairly significant issues, but here he is on the high ropes, so proud. Horseback riding, of course, a big part, which they all love that. And then Larry Geiger, who runs this long-term survivor retreat, did some questionnaires with them as well. He asked what was the best thing about this retreat? And these were some of the answers: meeting new survivors, seeing everyone and bonding again, hearing other survivor stories, which is so powerful for them, the circle discussion, which I talked about a moment ago, feeling normal again, because when they're in this group of other survivors, they can feel normal, even when they quite frequently do not feel normal outside of that circle, and to be able to share in a group. How did the retreat make them feel? They felt like they belonged. They felt more connected, more loved, more accepted, more happy and fulfilled. And a couple of them felt much younger. How would they describe the retreat to others? It's the one event I look forward to. It's very different than other camps because I love the camper independence, and which it is way different than our Camp Periwinkle with our younger kids where we're monitoring everything. It was amazing to meet others who have gone through cancer, and we are all survivors. And I think that probably came from one of the patients that it was their first time. It was the best, and it was awesome. Then what did you get out of spending the weekend with other survivors? Healing and support, a sense of normalcy, deep and lasting friendships and wonderful memories. We had something in common. Lots of serotonin, I love that. Feeling normal. My friends and my cup have been filled again. It's been hard on everyone not to have periwinkle. So then Larry did an impact survey at the end of the weekend. And the long-term survivors uniformly strongly agreed that they felt included, that the activities were right for their abilities, that they felt emotionally connected, and they all, of course, were glad that they came. So these are many survivor pictures. The older looking young man is in his, he's at least in his mid-40s by now, has twins. This is a young man who obviously is quite a bit younger, who has a brain tumor. This is pre-COVID at one of our retreats, which is, of course, much more highly attended than the one that we just had. Here's another picture of a lot of the survivors at a pre-COVID camp. And this, I think, is one of our most powerful pictures. These 2 boys happened to both be my patients. They were diagnosed about 5 years apart. They met at Periwinkle when the one with the little triangle on his hat was quite a bit younger than the other young man. The other young man suffers from some pretty significant neurologic complications of his therapy. Then the other boy, Mario, with the white triangle on his hat, had the exact same diagnosis, didn't have the neurologic complications. They both had the same recurrence of their disease. They met at camp 20 years ago, and they are best friends. And Mario helps Julian to get through life. He even helps him with job applications. So that's the kind of lifelong relationship that has happened through Periwinkle when they were young, but continues through the survivor program. Here they are getting ready to go canoeing, I suspect. And I think in conclusion, that the impact of the Periwinkle program wellness interventions, the socials, the retreat, were ranked as life-changing or extremely valuable in the huge majority of survivors, whether in person or virtually. I think the most important message is that establishing a social network of survivors in a non-medical environment provides critically important peer support, which really enhances their psychological wellness. Social programming directed at adult survivors of childhood cancer is a key intervention, positively impacting survivor mental health and wellness. And that pretty much concludes my talk. And I'm open for questions, but I cannot thank the Periwinkle Foundation enough for their innovative ideas and their can-do attitude to pretty much make anything happen. And there are all the different ways to connect.
Thank you so very much for all of that amazing information. I kind of was fighting back tears and you were fighting back tears. So
I know, I always do that.
It's our heart work, right? I mean, it's why we do what we do. So I do have a question. What advice would you give other camps if they were interested in expanding their program to incorporate a long-term survivor program?
The first and the most limiting factor is funding. And so the Periwinkle board chose to focus on survivors as one of their features. So we carved out funding to support that program. I think if you create the program, they will come. I think that monthly social idea was really clever. And one of our young employees was really a mastermind at helping to put that together. But I think funding is part of it. Now, what I don't know is, because we see survivors of all ages, we still have these kids around. However, a lot of the survivors that have participated in this program don't necessarily still come to the survivor clinic. They just know Periwinkle because they were Periwinkle campers when they were young. And I think that's kind of also part of the growth of the family, because to be suddenly cut off from all things Periwinkle when you turn 18 or 19 can be devastating. And because they've been your support for so long. So I think if you can carve out some money, and it doesn't take that much, you will absolutely get young adult and adult survivors who will benefit greatly from from a program like this.
Great. Well, thank you. Does anybody else have any questions? I mean, you don't want to type them in the chat. Feel free to unmute yourself and ask. Give people a couple of seconds.
It looks like there might be some things in the chat.
Yeah, that's myself. I'm reminding people.
That was you. Okay.
That was me.
I just want to say I've been doing this a few years, since 1982. I'm also, you gave me some tears for lots of reasons. I'm also a survivor myself of adults. But we tried for years, because I know how important this is. I would say a third or to a quarter of my counselors are survivors. And that's one of the ways that we keep them connected. But we need the money, there's no doubt about it, to do those socials. And I'm going to push a little harder now I'm part of the Valerie Fund, and it treats children with cancer, blood disorders as well. And we're in New Jersey. We have about 7 hospitals. I'm in New York. I'm going to push a little bit more. This was something that brought back some things in my mind that I wanted to do. And so I might be in touch with you for some help.
I can promise you your survivors will be grateful. And, I think it's particularly powerful for those that have those ongoing serious complications.
No doubt about it. Robert Wood Johnson in New Brunswick had started something like this, and it fell apart. And I think and this is probably 10, 12 years ago. So I think a lot of it's funding. And I think we need to find someone like the Periwinkle Foundation in New Jersey who would do this and help us with it. So I think
one of the interesting parts of this group there are parts of the group that are PNPs or physicians or lawyers, and then there are other members of the group that will never live on their own, but they're like on the same playing field when they're together.
Exactly. Yeah. I'm sure you see a lot of them look into the medical field. Many of our kids.
Yes, yeah, for sure.
They're 50, 60 years old, but they're my kids. And a lot of them are in the medical profession, which I think is interesting.
Correct.
All right, well, if there are no other questions, we'll go ahead and end this session. Dr. Dreyer, thank you so much for being part of our discussions today, and thank you for all the information. All right, again, remember this is a CEU accredited session, so please see the chat for the link and to get your credits. And we'll see you all in the next session. Thank you so much.
All right, thank you for inviting me.
Of course, Dr. Dreyer, thank you.
Bye-bye.